Hi, well, I'm Grant, and I just thought I'd say a bit about hospitals and things like that, and because it's all very exciting. Uh, I've got diagnosed with severe aplastic anemia. No, I didn't. I got diagnosed with aplastic anemia in 2006. Yes, and then I went into hospital for a month and had treatment called ATG, which was quite rough. It sort of makes you quite sick, and you don't lose your hair with ATG, which is good. But it does sort of knock you back a bit and knock you around and make you feel not so happy. But after that, everything was good, and you get put on cyclosporin, which isn't so fun, which are the pills like this. So that's these are the small ones, which are they're quite small, and then there's the so they're the 25 milligram ones. I think these are quite expensive, but I'm not sure, but I'll take them anyway. That is the medium-sized one, so that's fairly big. And then we have the 100. So that's a 50. Go from 50, and you go to a 100, which is quite a lot bigger. I'm holding those in the same. They're not like I'm holding them. They're quite a lot bigger. So that's an exciting thing. And you usually have to take. You have to keep your trough level of cyclosporin at 200. So you have to have about 2 of these a day, or sometimes you have to have 4 of these a day, depending on yourself, which is exciting. Plus, then you get a big bunch of other tablets for all sorts of other things. You also get one of these while you're in hospital. This is my first one. This is my PICC line, which goes in your arm here, up there, and into one of your arteries in your heart, which is fairly exciting. I got to keep mine. I was like, yeah, I'm keeping that. That's not painful at all. The only bit that's painful is getting the local, and then they just stick it in. It's fairly easy. There's no real sort of pain with that one. And also coming out, just pulls out. Doesn't hurt. It doesn't hurt. It just feels a bit weird coming through your arms, like pulling it out. The second time my aplastic anemia came back as severe aplastic anemia 3 months ago now, which I went to hospital for just over a month, and I had a bone marrow transplant, which my sister was the donor, which I'm very thankful for, and she gave 1.5 litres of bone marrow from her back, which is quite a lot. If you look at a bottle of Coke, that's absolutely heaps. You have to have chemotherapy, cyclophosphamide, which it's called. That's not so nice. It's more vicious than the ATG, but you also have the ATG as well. The previous time I had horse ATG, and this time I had rabbit ATG, rabbit antibodies and horse antibodies. Didn't have sometimes you get a reaction, which is called to the ATG, which is serum sickness, which you can get, and it gives you a huge rash, which I managed to get the first time, but the second time they used the rabbit ATG, and that didn't give me a rash at all. You get with the having a bone marrow transplant or any chemotherapy, you get a serious chemotherapy. You get one of these ones, which has 2 lumens, and in the middle of here it has a little sort of bobbly bit which actually grows into the skin underneath, which is not so nice. Putting this in, they give you a drug to stop you from remembering. They put it in, which makes it better. Also, they give you quite a lot of pain relief, and they also do local injection, local and stuff. You'll get a couple of stitches. You get one in your neck, and you also get one where they put the line in. And I don't know if you can see that there, but that's where the line was there, and so they have the line went in just there, up there, and over my collarbone and down. And you could actually feel and see it under there, and it just felt really weird. When they take it out, they have to make a cut just above where the line is to get that small thing out, because it grows into the skin, which that's probably one of the worst experiences ever, just getting that out, because they have to make the cut, pull it up through the hole and snip the skin away, and then they pull it out. Yeah, that was pretty graphic for the to watch, because she had the pliers in there, she's going like that, and no, that wasn't fun. And then you have to have the stitches as well, but the local had worn off for the last stitch, and that really hurt. Yep. So the hospital, you go in a sealed room, and you have to be like Bubble Boy, yeah, and you get your food passed through the hole, and people come in, they have to wear masks and gowns, things like that. If you're neutropenic, my neutrophils went down to nothing. My white cell count went down to less than 0.1, and which is pretty low. So yeah, that's yeah. What else? There was if anyone has any questions at all, I'm happy to answer anything that you might ask. There's the about the process. There's quite a lot of stuff you pick up yourself when you have this, because you're always told, you know, you always check your own blood counts to see what they're up to, and you check your pulse, and you learn how to use all the machines and stuff. It's quite fun. So it's not always bad. You can always get something out of it, you know. So got now yeah. So it's been a good experience as well as a bad experience. Yeah. But at the moment, all my blood counts and everything are back to normal, like a normal person. So, which is good. And the only thing I have now is is a thing called graft versus host disease, which you can get at different stages of it, different levels of graft versus host disease, 1 to 5, it's called, or something. Anyway, I think I got stage 1 or something like that, which is just a rejection of I think a healthy rejection of the bone marrow, just to say, you know, it's shown that it's working, and theoretically then it should, if it sees the aplastic anemia there, it should reject that too and get rid of it, which should be good. And but it seems like it's done that, which, yeah. So I'm on steroids at the moment, which makes you put on a lot of weight. Steroids do, they yeah, and they give you all sorts of things. Also, they have to give you skin biopsies and things like that, where they cut out little bits of skin to make sure you haven't got it. Oh, it's all very fun. They stitch you up and stuff and send you away again. And they took out my line last week or the week before because it had a infection in it. My temperature went up to 40.3, which is quite high, and they had all sort of heart problems and things like that. And but they fixed that and took the line out, and everything's fine. I'm fine now. So yes, that's just this first bit of my thing. If anyone wanted to make a video response or just comment and ask questions, that's fantastic, about any of the hospital stuff. And yeah, if you have it, good luck. It's a long process, but they know what they're doing. They're really good. Alright, catch you later.